Hey guys, Luis Moreno here. Think Medicare, Think ACA. I've got our guest, Jordyne from HealthSherpa. Hey, Jordyne.
Hey, Luis, thanks for having me.
Man, love having you on my channel. You always got lots of good information. And today we're going to be talking about passive renewals. But before I let Jordyne talk, guys, you need to do something for me. Please make sure that you like this video, post any comments down below. I respond to them. I'm the only one who responds to them. And then number three, if you're a subscriber, thank you. If you're not a subscriber, click that subscribe button. It'll help me out and also keep me producing videos like this for you guys. So Jordyne, we did a video already previously about active renewals and three ways that we can handle actively renewing somebody, and we'll explain the difference here in a minute, but there's three ways to actively renew. We're going to focus on this video on passive renewals. Jordyne, can you give me a quickie on the difference between active and passive?
Yes, the active renewal is the act of an agent or a consumer actively processing the renewal, meaning a person is submitting that application. The passive renewal is when the carrier sends the current plan over to CMS. CMS auto renews the policies, given that the consumer has not opted out. There's a few other reasons that they may not auto renew, but the passive renewal is a typical fallback for a consumer if they are not actively renewed.
And guys, I'm going to share a big problem with passive renewals. And it happened to me yesterday. I had a client call me. They were enrolled, I believe, I'm going to choose Molina. They were paying 120 something a month in 2024. It renewed, and the guy got a premium payment of 400 and change. Of course, he called me like, man, what happened? I'm like, you know what? You probably lost your subsidy. There wasn't enough income. Hey, did you make a little more money? Like, yeah, I am. I will be making a little bit more. You know what? Now we've got to go in there and actively renew it, which means I got his consent again. We went in there and watch the active renewal, guys. But I went in there, I hit the renew button. I updated his income. We chose the same plan. And by actively renewing it, premium was 120 something. It went up to 400. When I got done with that entire renewal, it dropped down to 79. Okay, way better premium, same plan, but all because I actively renewed it. So you want to try to do your best to actively renew. Now, my agency, we're working super, super hard to actively renew as many as we can, but we can't get to everybody. Not because we're too busy or we didn't have enough time, but because I can't get a hold of my client anymore. Maybe their numbers changed, maybe their emails, whatever it may be, they're just not responding. So the one good thing is that these things are going to passively renew. So let's talk about the passive renewal process through HealthSherpa. This video is being sponsored by Agent CRM. Agent CRM is a CRM that I use for my agency for every line of business: auto, home, life, commercial, Medicare, and ACA. It should be the CRM that you use too. Click up here to get some more information.
All right, I'm going to share my screen now.
And can you show the problem first before? Because I have a problem. They'll call me and I come like, well, and
Yeah,
I'll just say it right now, guys. The problem with the passive renewal is I don't see their 2025 plan. All I
that's
see is their previous year and it shows terminated.
Yep. And that causes immediate panic of why was their policy terminated and I haven't done anything for 2025. So there's a few things that you can do. And Luis, we're going to talk a little bit about reporting later. We're constantly adding tools to be able to help you manage your book and grow your book. So the first thing I would do is when you're in your platform, I'm in the clients section here. You've got this plan year filter. You can filter by 2024 to look at your clients for 2024. You can do the same for 2025. You have a few options here. You can download those separate reports and find out who had a 2024 policy that I don't see in my 2025 and just do process of elimination there. We're going to talk a little bit about some of the other reports later. If you don't have a filter on this section here and you click the export button, you'll be able to download all your clients and you can just do that from a CSV. You can change that into Excel if you'd like to work from Excel, and you can filter by the effective date or the plan year to see 2024 versus 2025. But a great way to look up the passive renewal. So first we would start with filtering by 2024, and then we're going to find, a client here that has a 2024 policy. We're going to open this up here and let's see if our test environment will cooperate with me today.
You want to know everything about ACA or Medicare? Click up here to get my ACA and Medicare Smart Books. While we're waiting for this to pull up, guys, what you will see in your HealthSherpa book of business, when you pull up your 2024, you're going to pull up the client tab. Oh, there it is. Let's see if it shows it. Oh,
So this one doesn't, but this is where you're going, Luis, right?
yes.
This section here is going to say terminated expiration 12/31/2024. So this typically causes a lot of concern, and we have agents calling into our support line saying, hey, why was this terminated? I didn't do this. Is my client going to lose their coverage? Well, the reality is they were passively renewed, but CMS does not push that data into our system. So you as the agent have to look it up. So it's very simple to do this. You'll come up to the search marketplace, and I'll use this example here. That's Arizona. And what is their zip here? So you're going to click search marketplace.
Jordan, while you're doing that, I'm going to get a quick glass of water.
Sure. You're going to attest that you've received permission from this consumer to work on their behalf, and you'll search the marketplace. Now, this is our staging environment, which is our test environment. These are all fake clients in here. On healthsherpa.com, this is our site that's directly connected to healthcare.gov. You're going to see a box down here that shows you the upcoming plan year. So for this example here, we'd see my client name test in Arizona, date of birth, and you're going to have some buttons that you can click on. And the one that you want to click says add to clients. So you're going to look for plan year 2025, click add to clients, and then that will bring you back into the HealthSherpa dashboard, and it's actually going to bring you right into the client's profile. So we'll pull up a 2025 example here.
Guys, I've got a community of ACA and Medicare agents that we're putting together. 25 years in business is what I'm going to be sharing with you. We're going to be talking about client quotes and client scenarios. We're going to let you tell us your scenario, and we're going to tell you what we would do. We're going to have a monthly mastermind outside of AEP and OEP, and a weekly mastermind during those same time periods. We're going to share with you our lead gen resources and our ad templates so that you can generate more leads. We're going to share with you a terminology PDF with all the acronyms for Medicare and ACA. And AI. AI is huge. We're going to share with you how we use AI in our business. We're going to be hosting workshops on how to run a business, how to handle taxes and your financials. We're going to do carrier-specific trainings. We're going to help you with certification and with all the compliance that we have to deal with ACA and Medicare. And finally, tech tools. We're going to share with you all the tech tools that we use and get you discounted rates. And huge money maker for us is the ancillary sales. We're going to share with you how we sell the ancillary products to Medicare and ACA clients. Guys, come join us at the community, a community of ACA and Medicare agents, and we'll show you how to grow.
And you'll be able to view their 2025 plan. Now, we covered this in a video earlier, but let's say you pull up their passive renewal and, like your example, Louise, it's just not going to work, or something changed and their premium has gone up. You still have time to go in and make changes to the application prior to the 15th. So you can do that by clicking edit application or change plans, and you'll be able to process changing the plan, updating their income, whatever you need to do. And that is how you handle the passive renewals. I really encourage everybody to make sure that everyone that was on your books for 2024 is also on your books for 2025. This will not only help you ensure everybody's in the right plan, but as you go into the year, it'll help you with servicing, making sure you've got the right documents. It'll help you keep track of those clients throughout the year, and so much more from within HealthSherpa.
Got it. So now that you've added that client 2025 to your book, and now you're seeing it. Now at that point, guys, they either you have it and you see, oh, you're fine, don't worry about it. And but it renewed with last year's numbers. Now it might be a good idea to talk to your client. Hey, let's just actively renew this thing again. Let's get in here and let's just process it. Guys, what I have noticed, and it's kind of hit or miss, but if all the parameters stay the same, literally I just go next, and go to the very end. What I have seen, guys, is sometimes they get more subsidies. Okay, so it really depends on the deal. So I would actively renew it again just to see if it gets better for them. Okay, now you're going to have to actively renew it again if you're switching plans. Is that right, Jordan?
Switching plans, same thing. If you're going through and just updating the application, that technically counts as an active renewal as well.
Yeah. So just get in. It doesn't take very long. But don't forget, guys. Okay, this is key. Don't forget our CMS requirements from us agents. We have to collect consent and we have to collect confirmation that they're reviewing the app and that everything is still accurate. Make sure you're collecting those too so that you don't get into any potential trouble down the road if there's ever a complaint and you're having to produce those.
And Luis, I'll just make a quick comment on that. Our team has done an amazing job building out resources for agents and for agencies. So I always tell new agents or new agencies that I'm meeting with to bookmark the URL faq.healthsherpa.com. That is our resource guide. We have lots of different tips from within the product. So if you ever want to learn how something works, we talked about the renewal email earlier and how we have these little question marks throughout the platform. Either we'll give you a tip on one of those question marks or we'll route you to the FAQ page. If you bookmark the FAQ page, you can go over there and you can search renewal. You can search any single topic, training, whatever you want, you'll be able to find it in there. So that's a great first place to start before you even have to pick up the phone and call our support team if you have a question.
Great. Awesome. All right, guys. So you now have access to 2 videos with Jordan leading the way here from HealthSherpa on how to passively renew, which is this video. And I will post a link in the description below for the active renewal and the 3 ways that you can actively renew utilizing HealthSherpa to renew those clients. Jordan, hey, thank you for your time. Truly appreciate it. Guys, don't forget, make sure you comment down below. Make sure you like this video. Give us a thumbs up. Okay, we don't get any thumbs up. Jordan may not come back. All right, she likes those thumbs up. So make sure you give us some thumbs up and that you like this video. And then also make sure that you subscribe to the channel. I'm trying to grow it. And the bigger it gets, the more videos that I can do and provide for you guys so that you guys can become better agents. Thank you, guys.
Thanks, Luis.